Hello, my name is Paige Steyer, and I'm an occupational therapy doctorate student from the University of Findlay. I'm working with UC Health to help create educational videos for patients who have acquired a spinal cord injury. This is my last project before graduation, and I chose to work with this population and educate myself in this area because I'm passionate about helping people with an SCI achieve as much function and independence as possible in their daily life. The learning objectives for this video are listed on the screen above, and we'll talk about the purpose of these videos, who these videos are made for, how you can navigate on which ones to watch and choose, and also how to learn about your level of injury. The videos on this page will be covering a wide range of topics that many patients with an SCI have. We decided the topics of these videos by conducting what we call a needs assessment. We did this by completing evidence-based research and talking with several healthcare workers such as occupational therapists, physical therapists, nurses, and a physical medicine and rehabilitation resident. But most importantly, we spoke with patients who have acquired an SCI and listened to their experiences. Here are the topics we've decided to discuss. We'll talk about your level of injury and what that means for the kind of movement you can expect. We'll discuss pressure sores, what they are and what we can do to help prevent them. We'll educate on bowel and bladder management based on if you have an upper level injury or a lower level injury. We'll talk about sex and intimacy and some of the changes you might be experiencing. We'll provide local and national resources for you. We'll go over some different dressing options and adaptations, whether that be adaptive equipment or different kinds of adapted clothing. We'll provide extensive training and education and transfers for both you and any family or caregivers that may be helping you, whether they might be using a slide board or a machine like a Hoyer lift. And finally, we'll talk about some assistive technology options that can help to make you as independent as possible in your daily life. These videos are meant to act as a resource for you, patients, families, caregivers, whether you just recently had an SCI or you had one years ago. This information applies to anyone. Each video will be about 2 to 3 minutes in length for your convenience in viewing the information. They'll be labeled according to their topic, so they should be easily accessible and manageable when looking for specific information. And you don't have to watch the videos in order or watch them all at once. It will be up to you to decide which videos you'd like to view and when. Make sure to reach out to your healthcare team or therapists about what level your injury has occurred at. This will be useful information for you to know moving forward and will lead you to selecting the right video to watch later on. You can expect them to say anything from C1 to C8, T1 to T12, L1 to L5, or S1 to S5. Again, we'll go over what all of this means in an additional video. Overall, there should be something on this page for everyone. Please reach out to your healthcare team and your therapists with any questions you might have when watching these videos. These interventions are research-based and used by healthcare practitioners. People who have acquired an SCI have assisted in creating these topics by sharing their experiences and where they believe there is room for growth and change. So along the way, please let us know what we can do to help.